Assalamu alaikum, brothers and sisters. Good afternoon to you, wherever you might be. I hope that I met you well. This is your sister, Aladebura, your health and well-being coach, your nurse, your counselor. I just want to have one or two discussions with yourselves. I hope that I've met you well. If you're able to join me, please let me know where you've joined me from, and let me know your name so I can acknowledge you. Good afternoon. Sorry, I can't pronounce this. I'm sorry. I've invited you. Okay. Good afternoon, Nara. Thank you for joining. Thank you. Follow the host. Thank you. Hakami, thank you for joining me. User Eto, thank you. Salam alaikum. Salam. Neely, thank you so much for joining me here today. I appreciate you. Good afternoon to you. Oknuma, salam alaikum. Do we? Let me see your name. You said we look so similar. Maybe. You never know. We never know. We never know. And I think we should actually get acquainted more. Salam, how are you? Imam Afa, how are you? Okay, I'll add you, sir. I'll add you. Okay. Please send an invite to me and I'll bring you up. Thank you so much for being part of this show this afternoon. How have you been coping? I would love to know. Really, you said you keep on seeing me everywhere. That's nice. What do you think? It's good. It's good. You see, you know what they say? Great minds think alike. Great minds think alike. So if you and I kept on meeting everywhere, so it's showing that we have something in common, and I'm sure it's very good. Natalie C. Robinson, how are you? Kieran Love, how are you today? Juliet, thank you so much for being part. As you're coming in, can you power tap? Can you also try and help me to meet my goal? Buy me gifts, please. Nothing is small. Flower, it's okay. Just to show that, yes. And I would love to see your comments. Adebayo, thank you so much for being part of this. Dynamic, Sally, Clinic. Your names are coming up so fast. Your names are coming. So if I miss your name, I'll try and go back again to acknowledge you. Dynamic Joy, thank you. Farmai, thank you. Dynamic J, thank you. NM, thank you for being part of this show today. I love you so much. I appreciate all of you. I really do. Thank you. A2, thank you. JJ, thank you. Sorry, TAN something. I appreciate you. Thank you so much. Thank you. Frank, you're welcome. Good afternoon to all of you. Or good evening. I don't know where you've joined me from. How are you today? How have you been today? Sorry, don't mind my tongue. My tongue is a bit white. That is because of fasting. I've just seen it that my tongue is really white. Okay, so today, what are we discussing today? The last time I was on air, one of my followers, my friends, Maslim, thank you, Rexan, how are you? Here I try to we discuss matters pertaining to our health and well-being. Keisha 06, thank you. Thank you so much for being part of this. I appreciate you. Okay, I've pinned something down there. See if you have points that you can just comment on. How are you, Hala? How are you, Dynamic? How are you, Sue? How are you? How are you? Thank you so much. I am airing from London. My TikTok business name is Saladewura. I am a qualified and I'm a UK trained, qualified and registered psychiatric nurse. I am also a certified coach, counseling on health and well-being or any emotional issues. I also counsel people on pre and postnatal depression, pre and post nuptial. Liverpool, thank you. Leila, how are you today? I pinned something up there. I don't know if you all can see it. So if you can see it, these are matters. What would you like to discuss today? So this my friend, who was one of my viewers, actually. Imam, I'd like to please send me an invite so I can honor your invite, sir. Imam, please do so. Yes, we look familiar. I need to know your name though. Yeah, my sister. You're my sister. You're my TikTok sister. Mashallah. For my Muslim sisters and brothers, how have you been feeling today? How's Ramadan going? Alhamdulillah. Ramadan is coming to almost to the last 10 days of Ramadan. To you, my Christian brothers and sisters, how have you been? You've all just finished fasting as well. How was the Easter break? Did you enjoy your Easter break? Did you get a lot of eggs and all that? So, having said that, because I really do not intend to spend too much time and I don't want to waste your time here. Now, I did promise that when I come online, we will talk more about depression and anxiety. I've introduced myself. I'm a qualified psychiatric nurse consultant. I practice in the UK and I practice abroad as well. I have my health and well-being consulting page on Facebook, should in case you want to message me for any one-to-one counseling. So today we want to look into, please, if you want to join me, send an invite and I will invite you. Please, just send an invite, send a request and I'll bring you up. Because I want this to be an interactive section. I want us to discuss what are the experiences of one another, because our experiences in life varies because of our background, because of things that we have been plighted by, because of different situations and challenges that we have been faced with.
Assalamu alaikum.
Wa alaikum salam wa rahmatullahi barakatuh. Ẹ máa káàsán, Imam, ẹ máa ṣe gan ni. Ẹ jọ̀ọ́, ṣé ẹ
Ajami
lè
iṣẹ́ wa dáadáa mọ̀.
a dúpẹ́ lọ́dọ̀ Ọlọ́run. Ẹ jọ̀ọ́, ẹ tiẹ̀ kọ́kọ́ ṣàdúrà fún wa náà bẹ́ẹ̀ tí ẹ kọ́kọ́ join wa náà ká fi bẹ̀rẹ̀. So the Imam here is going to pray for us as we begin to go into our discussion. Bismillah.
Alhamdulillahi Rabbil Alamin. A
Alhamdulillah.
dúpẹ́ lọ́dọ̀ Ọlọ́run.
Alhamdulillah.
Gbogbo tí Ọlọ́run bá ṣe fẹ́ dá ẹ̀dá láti máa dúpẹ́ lórí ẹ̀.
Bẹ́ẹ̀ni.
So, pẹ̀lú pé ó fún wa ní a great opportunity láti wà. Then ó tún ṣọ́ wa nínú ààwẹ̀ Ramadan tí a wà ń bíbẹ̀ yìí. Olúwa kó jọ̀ọ́ kí ó tún bọ̀ ṣe àlékún ẹ̀ fún wa.
Amina.
Kó dẹ̀ má dààmú wa.
Amina.
Amina. Èyí tí a fẹ́ bẹ̀rẹ̀ ní ìsinyìí k'Olúwa kó jọ̀ọ́ kó jẹ́ kó mú ọ̀pọ̀lọpọ̀ àǹfààní fẹ́nìkọ̀ọ̀kan.
Amina.
Kó má jẹ́ ká gbààwẹ̀ yìí, kó má jẹ́ ká gbà á lásán. A fi ànábì ọ̀rẹ́ rẹ̀ a fi bẹ̀ ẹ́. Olúwa kó jọ̀ọ́ kó jẹ́ kó rí bẹ́ẹ̀. Wala hawla wala quwwata illa billahi. Àwọn alájà wa náà. Ọlọ́run kó bá wa gbàdúrà tiyín náà.
Àmín.
Olúwa kó bá wa kún yín, kó bá wa dúró tì yín, kó bá wa wà pẹ̀lú yín, kó má
Àmín.
fi yín lẹ́nu àánú ẹ̀.
Àmín
Èyí
Allah.
tÓlúwa ti ṣe fún yín tẹ́ ń dúpẹ́ lé lórí, Olúwa kó jọ̀ọ́ kó má sọ di ìbànújẹ́ mọ́ yín lọ́wọ́.
Àmín Allah. Àmín.
Ìmọ̀ bẹ̀rẹ̀ rẹ̀
Àmín.
àfi bẹ̀.
Àmín.
Bismillah iná àtọ́ yìí nà.
Bismillahirrahmanirrahim. Mina tena kalkasa. Fasali rukana. Ina shina kaunata. Àmín. Àmín. Ẹ ṣé bàbá, mo dúpẹ́ púpọ̀. Thank you so much for all of my viewers. If I've not been able to mention your name, you're acknowledged. You acknowledge. We're going to be speaking in English and also in my native dialect, Yoruba. So, bàbá, n ta fẹ́ sọ, ta máa ń sọ lórí ètò yìí ni èrò ní ìwòsàn ara àti àwọn nǹkan tó lè fà kéèyàn lọ máa ní depression ní bí àrùn ọpọlọ tó lè máa jẹ́ kí èèyàn lè máa ronú, tó lè jẹ́ kí àyè èèyàn máa já, tó lè máa jẹ́ kéèyàn máa sùn. I will say that in English. The topics to be discussed today here is or are factors that can contribute to you having sleep apnea, which is when you're not able to sleep properly, something that makes you anxious, challenges that creates unhappiness, sad mood, anxiety, depression. So please, can you tap, just let me see your messages on there. If there are things you want to mention, and let me know where you're calling me from. Sorry, where you're watching me from. So bàbá, kí ni nǹkan tí ẹ rí sí tẹ́lẹ̀ gbé wá, tí nǹkan tẹ́ lè sọ bóyá ní àwọn ìrírí tẹ́ ti rí and àwọn nǹkan wo lẹ mọ̀ wí pé ó máa ń fà á, àní kí ni nǹkan táwọn èèyàn lè ṣe lọ́kùnrin lóbìnrin tó jẹ́ pé a lè fi dín àwọn kinní yìí kù. Bismillah.
Alhamdulillah. Pertaining to what you said, pẹ̀lú nǹkan tẹ́ sọ yẹn. So, inú nǹkan kò sí nǹkan tó lè mú depress wá then tí ó lè má mú ọ̀pọ̀lọpọ̀ sùn. Òun ni tí wọ́n bá wà in deep thoughts. Tó já sí wípé ìrònú àbí kí n sọ pé ìrònú because ọ̀tọ̀ ni ìròrí. So, ọ̀tọ̀ ni ìròrí, ọ̀tọ̀ ni ìrònú. In a time tí èèyàn bá ń rorí, that means maybe you are thinking for a way forward. Wípé how can I do this so that make me so that will be forward. So I mean something like that. Òun ni ìròrí, which is ìrònú. Ìrònú ni depression. Maybe you have been working towards something, so but you cannot be able to acquire that thing. So or be looking at yourself, okay, with all my age, so I cannot be able to do this by myself. So I cannot be able to gain this. So you now put all these things in your mind. It will cause depression. Ó máa wá fa depression fún yàn. Wípé can I make it in my life? So can I make this in my life? Can I make that in my life? So èyí tí èmi kàn lè sọ lórí ẹ̀ gẹ́gẹ́ bí ọ̀rọ̀ Ọlọ́run tí ó fi kọ́ àwa, ẹ̀yin nísìn nọ́ọ̀sì lẹ̀yin lójú ọ̀nà yín tí ó sì dá yín lójú, tí ẹ sì lè máa prescribe pé tó tí àrùn báyìí bá ń ṣèyàn, nǹkan báyìí ni ó ṣe, nǹkan báyìí ni ó ṣe. But nọ́ọ̀sì tọ́lọ́run ṣe àwa náà ni wípé káwa náà ká báyàn sọ̀rọ̀, ká cancel èèyàn ṣá, pé kí gbogbo ẹni tí irú bẹ́ẹ̀ bá ń ṣẹlẹ̀ tó bá ń ṣe. So kò sí nǹkan tí ẹ̀dá tó gbọ́dọ̀ mọ̀ ni wípé ó fi ọ̀rọ̀ mọ Ọlọ́run, then kó má rora rẹ̀ pin. Kò sí bí age náà ṣe le tó, lópin ìgbà téèyàn bá mí sókè tó mí sílẹ̀, kò sí nǹkan tọ́lọ́run ò lè ṣe fẹ́dà. So ẹni tí ò bá ti mímọ́ tó ti kú, so òun ni kò ní solution sọ̀rọ̀ ayé ẹ̀. But lópin ìgbà tọ́lọ́run bá dẹ̀ fún yàn ní àǹfààní ìmọ̀ mí sọ́tùn mọ̀ mí sókè, so èèyàn á mọ̀ pé kò sí nǹkan tọ́lọ́run ò lè ṣe fún yàn. Nǹkan tọ́wọ́ yàn ò tí tó ń sìn with a minute, kò sí nǹkan tọ́lọ́run ò lè ṣe. Ó ní máa bayna gamdati aini watiba atiha. So within a seconds, within a minute, so you can acquire what you've been work towards for a long time. You can acquire it in a minute. So torí pé yughayyirullahu min hali ila hali. So Ọlọ́run ó kàn máa ń change movement ẹ̀dá, so láti ibì kan síbì kan tó jẹ́ pé oore tí ò tiẹ̀ ro kan yóò kàn tẹ̀ lọ́wọ́. So this is nǹkan tẹ́mi kọ pé nǹkan téèyàn ti believe pé kò lè jẹ́ tèmi, so á kàn jẹ́ tọmọ ènìyàn lẹ́ẹ̀kan náà. So èmi á kàn ní ẹni tí irú bẹ́ẹ̀ bá ń ṣe kó try láti calm ọkàn ẹ̀ down, so kó ní sùúrù kó dẹ̀ fọkàn sí pé Ọlọ́run lè ṣàánú èmi náà. Téèyàn bá ti mú ẹ̀mí pé Ọlọ́run lè ṣàánú èmi náà, so gbogbo nǹkan yìí máa jẹ́ rọrùn, ó dẹ̀ máa di rọrùn fẹ́dà.
Inshallah, inshallah. Ẹ ṣé púpọ̀ púpọ̀, àáfà, mo dúpẹ́ lọ́wọ́ yín. I hope you lot are listening and you've heard all that our Imam here have advised us on. Take our time, not to rush. Please, power tap, power tap, power tap. Fat drop. Ẹ bá mi power tap ẹ jọ̀ọ́. Please power tap. Share this, because you never know whom you're going to help, whose life you're going to save. Power tap, share, and please comment. Don't forget to help me to meet my life goal, please. So, in life, we're all faced with challenges and life adversities. However, where there is life, there is hope. If we were all to look into the way the world is today, if it's not financial problem, it's family problem. If it's not family problem, it's probably marital issue. I've mentioned financial problem, which can stem from unemployment. It could be your own health issues. But you know what? Every time you're down, you're being pushed to that corner where you're experiencing a bit of hopelessness. Try to strengthen yourself up by focusing on, for example, if you're a family man, you have your wife, you have your children, the joy of your life, and they don't want to lose you. If you are sad around your family members and this is going on for a much prolonged time without you seeking help, it's most likely to be picked up by your children. And you know how our children love us. Our children never want anything to happen to us, just like it's vice versa. And this is why we must seek help. In UK here, you have charitable organizations like Mind, MIND. If you Google it, you'll find a number there. I apologize for this noise. I think there is a building work around me here. Or even if it's Salvation Army that you go to, and then go there, ask them to signpost you. They will signpost you, meaning that they will be able to direct you to, you don't need to tell them anything. All you need to tell them is, once you walk in, they just tell them that, okay, you need to speak to somebody. There's something on your mind that you need to discuss with somebody. They will understand, and they will know which charity to signpost you to. In a lot of times, you don't need money. It's only if you think you want to go private, then you seek the service of people like myself, counselors, certified counselors. Then your counselor will meet up with you, talk to you, assess you through your talking, and then we'll plan out how many sessions you need. If you need sessions, if it's to signpost you to your GP, who will make the appropriate referral, to the professional body that you need to help you with your issues, such as depression or anxiety. If you need talking therapy, it will be done for you. The referral will be made for you. Talking therapy helps you to talk to the professional, to the professional who will listen to you and will, from what you're divulging, because when you talk, when you talk you talk to somebody who is trained, well trained in this area of your need, that person is not to judge you. They're not even to question you unless you want them to say something. It's to listen to you until you're relieved of whatever has been bugging you and that you've kept in your mind that's troubling you. When you hold thoughts in your mind for too long, it can impair on your cognition. When your cognition is impaired, the way your sense of reasoning and rational becomes impaired. Without you knowing, you could be making decisions, wrong decisions, that could affect you negatively and your family members. Even at work, people who are affected by either anxiety or stress tends to have withdrawal symptoms. I've said this many times on my page. Thank you so much for the likes. Please let me know if you want to come up. Just send the request and I'll bring you up. My friend the other day was on my platform, mentioned anxiety. He said that he's an army, and he said the army tried to help him. And a lot of times people have been saying that it could be from his background, maybe what actually led to him being so anxious, and that makes him experience, or while he's experiencing anxiety and depression, could have stemmed from his background. I know what I said that day was, it could be, and it might not be. It could be that, or it might be while he's growing up, maybe his environment. It could even have stemmed from work. Because when you're working in an environment which is very stressful, and we must remember something, how that our coping mechanisms, the threshold of our coping mechanisms is differs from one person to the other. What one person can tolerate and manage for a year or for a lifetime, somebody might not be able to cope with it in a week. That does not mean that they're weak, but it just means that the threshold, the coping mechanisms threshold is not as much. So everybody is different. So anybody that's trained in the UK knows that part of your training is, when you're assessing your patients or your clients, you're not meant to use the same method of assessing everybody. You must not use the system of one coat fits all. Our challenges in life are different. Like our coping mechanisms threshold is different. Somebody could say something to me and I might be able to just shrug it off and walk away. You might say it to somebody and it might just trigger an unpleasant mood in them, because this person have been harboring some kind of pain in their hearts. They have been subjected to some life experiences that has created some kind of disturbances in their life and in their cognition, in their thoughts, in their mind, in the way they see things. Some people's environment had actually affected their mind to the point that they do not trust people anymore. When you feel and you can sense that you are experiencing this, please do not hesitate to ask for help. you can go to your general practitioner. If you live in the UK, we refer to our doctors, not all doctors, but the doctor that can see you, the umbrella doctor that see you for every diseases. That's the first point of your call of seeking for help. You can go to your GP. Your GP will listen to you, and your GP will appropriately assign you or transfer you to the right professionals. In some general practice offices, they work with counselors that you wouldn't have to go somewhere else. You'll still be seeing a familiar face. You will still see it's still a familiar face. That please, if I missed your request, send it back to me. Send it back to me. Sorry if I missed your request. Some request came up, but because I was at a point of highlighting some issues, I didn't want to be distracted. So in other areas of the world, I don't know if you have general practitioner, if it's your nurses, if it's just your doctors, you call them. And please do not lock yourself up. Anxiety, depression, or stress is not a sign of weakness. It's an ailment, but it does not have to be.
Hi, do you want a battle?
No, sorry.
No probs.
It doesn't have to. You can even have a friend. There is a charity as well that's called Says. You don't. Sorry. Yeah, befriender. Befriender simply means you don't have to see this person face to face if you don't want to. But it's a very safe way of. This, I don't want to sorry, people are asking to have battles with me on or game or something. No, sorry, not this time, please. This show today is about highlighting help for people who are going through depression, anxiety, and stress. Women, we go through, men as well, we all go through life adversities. But women, I'm now going to be mentioning women who are like nursing mothers. Nursing mothers, some of us, we experience what we call postnatal depression or prenatal depression. Some people, they know this because during the time of their pregnancies, the midwife or the GPs will probably have picked this up during the antenatal visits. If not, if you feel like from time to time you're weepy, you just don't want to talk to anybody, you're moody, every little thing makes you tearful, please discuss this with your midwife. Your midwife should be able to signpost you to the appropriate place. This this can be part of your care plan towards your delivery, so that you do not lose out and you don't have to manage on your own. If you don't have access to all these that I've mentioned, please discuss with your family members that you can trust. Your family members are there to lend you their ears to listen, listening ears. In your relationship with people, you must have picked out those that you know that you can trust, that will not go out blabbing about your issues. Confide in them. Speak to them. Let them know what your issues are. Where you're limited regards information, these people might have informations which they can help you with. Before and after the delivery of your baby, there is what we call baby and mothers unit in the UK. I'm not sure where else in the world. But if your health practitioner is not aware of the issue which you're experiencing, this will not be part of your care plan. By all means, if your health practitioners are aware of your need, i.e. counseling, i.e. for example, a befriender, even you and your partner will be invited, and your partner will be educated of what you're experiencing, what you're going through, so that your partner too will know how to support you in the house without judging you. You know, some partners, because they don't understand how our body change and how pregnancy changes our thoughts, our moods, the activities, in the chores, shopping, communication, how things changes, how pregnancy could alter your hormones. Men sometimes don't understand this. Àwọn èèyàn wa, àwọn èèyàn ọkọ wa, wọn ò kì í sábà mọ̀ wípé tá bá lóyún sínú, pé oyún ó máa ń change àwọn nǹkan kan ní ara obìnrin. Àwọn ọkùnrin, ọ̀pọ̀lọpọ̀ ọkùnrin ò kì í mọ̀. Ó kàn máa di pé ṣé wọ́n ló kọ́kọ́ máa lóyún ni, ó dẹ̀ ń kanra, amẹ́lẹ̀ ìwà olóòfẹ́, amẹ́lẹ̀ ìwà olóòjẹ, amẹ́lẹ̀ ìwà olóòmu, amẹ́lẹ̀ ìwà kíní kankan bẹ́ẹ̀ yẹn. Ṣùgbọ́n tí ẹ bá ti lahùn fún midwife yín, tó bá dẹ̀ pé doctor ní pé mi kì í lè sùn, ara máa ní ọ̀tá mi, tílẹ̀ bá máa mọ́, mi ti ẹ̀ fẹ́ ríyàn kankan, ó máa ń dàbí pé mò ń kanra. Ó yẹ kí midwife yín invite ọkọ yín wá. Ó yẹ kí midwife yín ti mọ̀ wípé ẹ ti ní postnatal stress nìyẹn, tó dẹ̀ jẹ́ wípé tí wọn ò bá tètè dá sí, ó lè di depression. Òun náà fi máa ń pa àwọn kan ní Nàìjíríà ní alábìsínwín. Kì í ṣe sínwìn. Tí wọn ò bá tètè fún ẹni yẹn ní ìrànlọ́wọ́, ó máa di wípé obìnrin yẹn máa ní depression tó pé tó bá bímọ kò fẹ́ rí ọmọ yẹn sójú rárá. Kódà ọkọ gan kò fẹ́ rí. Ó máa kanra ní. Nítorí wípé àwọn tó wà lágbègbè ẹ̀, Aliyah, please shut that door for me. Àwọn tó wà lágbègbè ẹ̀ ní ìgbà tí gbogbo àwọn kíní yẹn ti ń bẹ̀rẹ̀, wọn ò mọ ohun tó ń ṣe, wọn ò mọ ohun tó ń dà láàmú. Ó di pé ó ń kanra, ó di pé ó ń pariwo, ó di pé kò sí ọkọ gbé bọ́kọ bá gbábọ́ kọ̀ọ̀kan ò mọ́ gbé. Bí àwọn ọmọ ẹ̀ tó ti bí gan bá bẹ̀, ó lè gbá wọn létí, ó lè ṣe nǹkan. In UK here, when a woman starts to experience postnatal depression, and if this person is known to be a sufferer of postnatal depression, in her care plan, things would have been put in place from the time of that pregnancy to the time that she gives birth. She will have support. In fact, some women are relieved of having too much contact with that baby because, babies, they cry, they're needy, this and that. It's either that person is assigned with an helper that will visit the home, or if the woman or the mother is still on admission in the baby and mother's units, there will be a carer or carers that will be looking after the baby. Even if the baby needs to breastfeed, all the baby needs to do is to express a milk, and then once the milk is expressed, then the carers will make sure that and the nurses will make sure that the milk is kept at the right temperature and the baby is fed, looked after. So all the stress of looking after the baby, the mother will be relieved. The mother will have her own carers that will make sure that she's okay. And the mother will not, the mother and the mother and the baby will not be discharged until the mother is okay, and the husband as well is mentally okay to support both the mother and the baby in the house. So ẹ jọ̀ọ́, ẹ má suffer in silence. Tabarẹni tó fẹ́ bá mi sọ̀rọ̀, bá mi dá sí, ẹ send the request, màá gbé yín wá sókè. Ejo, please, you can join me to come out if you have any experience with what I'm speaking or talking about. I've been talking about anxiety, stress, and depression, but most especially about prenatal and postnatal depression. Oni ilẹ̀ Yorùbá tèmi tí wọ́n máa ń pè ní àbísínwín, bọ́ kò kí ń ṣe àbísínwín tí obìnrin yìí nígbà tí ó ti bẹ̀rẹ̀ oyún níní yẹn tóun náà bá ti ń sọ wípé bára òun ṣe rí nì bára òun ṣe rí nì fún àwọn tó bá wà nínú tó ń bá ṣe ìwòsàn yẹn, meaning that your carers, your midwife, your doctor, once they are aware that you are stressed, further investigations and monitoring will be put in place. And once your health profession, your health provider have determined that there are enough reasons to diagnose you with postnatal depression, in your care plan, everything that you need will be put in place. You'll be checked, you'll be looked after without actually stepping on your toes or encroaching on your space, which can also make people uncomfortable. But most especially, your partner, your husband, will be invited to understand your diagnosis and needs. How much that you need, how much help that you need. And you will not be left alone to suffer in silence. Care plan will be put in place for you from that time of you carrying that pregnancy to after the delivery of the baby, and until your health care providers are sure that you are okay to be discharged home, so that you can carefully, safely look after your baby and without impacting on the health and well-being of your husband as well or your partner, then you'll be discharged home. So please, ladies, do not suffer in silence. Ẹ̀yin tẹ́ wà ní ibi tá ti ń ṣèdè mi, ẹ má tìjú, ẹ jọ̀ọ́. Mo mọ̀ pé people have stigmatized this all over the world. In UK, we refer to it as prenatal and postnatal. Prenatal assessment will be done. Care plan will be put in place to support you. And this will not be done in your absence. Your care plan have to be patient-centered. You will lead that care plan when it's being written, because you have to discuss that, okay, this is how I feel, but I think if this is put in place for me, it will help me. It will help to alleviate the tensions around me. It will help me to subdue whatever feelings that triggers my depression or anxiety. If it's because working too much or because you have younger children at home, you know how children are. See, you must have heard my grandchildren also crying. I know it's because they need my attention, because once they don't get my attention, they start to problem. They start to fight each other, but the sister is there looking after them. So young children, they need our attention, but they don't understand that you're going through depression, anxiety, or stress. They don't. But unfortunately, for some of us that are either going through prenatal, postnatal, or depression without pregnancy or anxiety or whatever, if we don't seek help And then you have, let's for example, you have young children around you. They're playing around this and that. I'm sure people, if you want to tell yourself the truth, you will just scream at them. Sometimes you punish them unnecessarily. You shout, you give them a timeout. You say go and sleep. But these children need to be listened to. But do not be hard on yourself. We are not able to pick this up that these children need help. They need to be supported. They need this and that. They need to be listened to because we ourselves, because we are in need of help. We're in need of help and we've ignored those symptoms. When normally, when there are situations which you would have calmly dealt with, you see yourself shouting. I know I've been shouting, sorry. That's because I want you to hear me properly. Not that I'm saying you're deaf or anything. But you know what I mean. You know what I mean. I'm sure everybody that's listening to me, you all know what I mean. You know what I meant by, I just invite Afa Adeyemi Olofa. Maybe wọ́n lè rí nǹkan àbí méjì tán lè bá wa. So thank you so much. Manja, thank you so much for being part of this. Thank you, all of you. I've mentioned some of your Toju Are. Thank you so much for joining. Salamu alaikum. Eshegon Frank. Thank you for still staying with me. Please share. Share because what we discuss on this platform, it's only when we share it, people that need to benefit from it will get it. Please share it. Share it. Don't be selfish. And you're not power tapping. Please power tap. Power tap. This page will go down if you don't power tap. And I haven't seen people giving me gifts. You're not giving me flowers. You're not giving me anything. Why? Don't you enjoy what I've been talking about? Huh? Don't you enjoy it? I know at the beginning I did say that I won't spend too much time because it's coming to the time for me to go and do my Asri prayer. But as I promised that from time to time I will be coming online in between. After Ramadan, I will make sure that I have a stable program and I'll be consistent. I promise that. And I'll be bringing up different issues, different topics as people have been requesting for. I try to be informed by my viewers. So when people make requests about an health issue or they send me a message, I make sure that I focus on that. But it's only when I don't get any messages or requests about what I should talk about, then I pick my point. Now, today's topic is informed, and because last time I was online by what one of my viewers talked about. He's a soldier, and he said that the army have been helping him with his stress and anxiety, which actually has led to depression. But still, he's still experiencing it. And he said a lot of people that is, maybe, I don't know if he's consulted. He never mentioned that he consulted any health professional, but he said people that he's been talking to said that the anxiety could have stemmed from his childhood. I did not differ, or I didn't agree, and I agree. Reason being that being a professional, I cannot diagnose somebody just by talking to me. I need to know your background. I need to know your family background. I need to know your environment, which your past environment and your current environment. I need to know the situation at your work. Okay. Sorry. Okay, I'm going to have to round up very quickly. I'm so sorry. I don't want to. But my battery is low now. It's been warning me. So please hold on to this conversation. Hold on to this thought until when next I come on to speak to you, to engage with yourselves. Thank you so much for being part of this. I appreciate you. But next time, I would like you to give me gifts, Power tap and share, please. I love you so much. Until I meet you again, bye-bye.